Welcome back. As we continue to spotlight on Breast Cancer Awareness Month, we want to continue shedding light on the realities of diagnosis, the power of early detection and the advances in treatment, and also the ongoing commitment of patients and healthcare professionals alike working together towards better outcomes. Taking that conversation forward now with Dr. Ashok Vaid, Padma Shri awardee and Chairman of Medical and Hemato-Oncology at Vedanta, the Medicity. Good morning, Dr. Vaid. Thank you for being with us here on the Breakfast Club. This month overall spreads awareness around breast cancer, but in totality, this is a conversation we must have in every household, in every important event, gathering, platform. Tell us, Dr. Vaid, first up, since you have observed this story of change over the last few years in the Indian context, how are you looking at the progress science and technology has made in treating breast cancer?
Very good morning, and many thanks for having me on this program, very important program on breast cancer. So when we talk about the change could be discussed in certain aspects. Number one, the shift in the number of cases we are diagnosing. 20 years back, cervical cancer was number one amongst women, and everywhere, the cities, villages, everywhere. The major shift in the last 20-25 years is that breast cancer has become number one and cervical cancer has dropped to number two. And the numbers are increasing. Also a shift in the age at which we are diagnosing more younger patients. And then one can understand because there is a shift in the lifestyles, the economic pressures, more women are working, late marriages, late age at first pregnancy, no breastfeeding, so on and so forth. So that's one change, the numbers, and then the overall demographics. Number two, the big change is the understanding about breast cancer by the medical science itself. Now we know breast cancer is not one disease. It's a disease, it's a group of diseases based on the biological characteristics a tumor cell carries and what the pathologist tells us after the analysis of these characteristics. And the pathologist would put these numbers into different categories, and the clinicians, a doctor like me in the clinic, would treat the patient based on the inputs one would get from the lab. And therefore, each patient would get a treatment which is based on the individual characteristics. It's a personalization of treatment. It's a individualization of treatment. That's number one. And then what that individualization translates into or transcends into is we are using not more chemotherapies at the moment, but we are using chemotherapies along with more targeted therapies, more immunotherapies, and much more precise. So therefore, we are now almost in an era of precision medicine. I talked about individualization, of personalization, and then the last is the precision medicine. The third change is based on the biology of this disease. Imagine about 20-25 years back, most of the women with a small lump would go for surgery first, some treatment after, radiation, and would pop a pill for 5-7 years. No more. As I said, based on these characteristics, we are treating a lot of women with chemotherapy, immunotherapy, and targeted drugs before surgery. I heard the conversation earlier that a lot of women can go for conservative surgery. That goes to say they don't have to remove the entire breast. So, and these therapies before surgery are helping us achieve that goal in a much more effective manner.
And how would you explain that story, Dr. Vaid? So how is conventional, traditional surgery, for instance, very different from these new age solutions, including chemotherapy? Because the sound of each of these, be it surgery, chemotherapy, at least to the patient is very scary. A lot of fear comes with it.
It's a very, very pertinent question because it's a difficult diagnosis, changes one's life in a moment. And one would always want therapies which are more patient-friendly, which don't give you side effects. Chemotherapy drugs have been in use for the last more than 50-60 years. And these drugs fight the cancer cells one-on-one. They go and track the cancer cells and kill those cancer cells. because they are tracking these cells on the basis of certain characteristics which are shared by normal cells also. So there is an innocent bystander effect, collateral damage on the body system, losing hair, low immunity, infections, mouth sores, diarrhea, feeling weak, feeling fatigued, so on and so forth, skin and nail changes. Though they revert, most of them would revert over a period of time. But who would like to go through that? Now, these targeted drugs, immunotherapies, and the other targeted therapies are actually harnessing, the immunotherapies are harnessing the body's immunity. The immunity goes to sleep in cancer, and that's one reason why cancer evolves and spreads. These drugs go and wake up the immune cells and tell the immune cells to go and fight the tumors. So it's not a one-on-one fight. It's a fight through the immune system in very simplistic words. And then therefore the collateral damage is not as much as would happen with chemotherapy for most of the patients.
But would the therapy or the treatment line not vary, based on what story the patient is carrying, for instance? So what type of cancer is it? What stage is it?
Exactly. That's what I said, that we have understood the biology much better. And the expression of some of these markers on the cancer cells, which can be done in the lab, tell us what drugs to choose for an individual patient. So every patient will not get chemotherapy and immunotherapy. Someone may get immuno, someone would get targeted, someone may still get only chemotherapy, even today, because their tumor cells are not carrying those markers which make them eligible for taking immunotherapy or targeted drugs.
Okay, Dr. Vaid, very quickly, because we're running out of time, I do want to ask you what you touched upon right at the beginning. So lifestyle is a contributing factor. Heredity is another contributing factor. There are several such factors at play. In terms of priority or hierarchy, how would you place them? How much of a role do each of these factors play? To what extent should patients, those suspecting cancer, should watch out for these signs?
So one line, we still do not know the exact cause of breast cancer. So there are risk factors. But carrying those risk factors, a strong message which I would like to give to the women is not that if you carry the risk factor, you are going to get breast cancer. No, that's not the story. The risk factors include, of course, the hereditary, the bad gene, the BRCA gene, which can travel in families. Number one. Number two, as I enumerated, the late marriages, late pregnancy, no breastfeeding, because that leads to a longer estrogen exposure within the body. And the longer the estrogen exposure, the more the effect on the breast tissues, because breast tissues in women are more evolved, and then they are all the time dividing. These cells are dividing. And then the estrogen can have a bad effect on these cells. So the probability becomes higher. Being overweight. So optimize your weight. Now, the WHO has given an alert that 20% of the cancers are going to be associated with obesity only, lack of activity, overweight. So a strong message to everyone, stay fit, exercise. You will not only benefit from cancer, diabetes, cardiac, stroke, everything. Your joints and muscles would stay better. So there is a strong message in that. Don't use alcohol, don't use tobacco. And then whenever you are taking any hormone replacement pill, discuss with your doctor.
Yeah.
Not that they are bad, they are good for certain individuals. So there is nothing absolute bad and good. There are relatives, there are risks, and if you carry those risks, make your lifestyle better so that your exposure to estrogen is not high and you have a lesser chance of getting breast cancer.
Yeah, Dr. Vaid, every health professional we've spoken to on the Breakfast Club has had this one suggestion, be it your brain, be it your heart, be it your kidney, your lungs, or your breast for that matter, lifestyle holds the key to living a healthier and a longer life. Thank you so much, Dr. Vaid. Always a pleasure speaking with you. Thank you for joining us this morning.